The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome to another episode of the Dental Brief. I'm so excited for today's guest, for today's topic. It's going to be a lot of fun. Let's just go ahead and introduce yourself. Tammy, tell us a little bit about yourself. Tell us your background, how you got involved in dentistry, and then we'll jump in from there.
Okay, real quick, my name is Tamara Stillwell. I am the VP of Operations for United Dental Co-op. I began dentistry, I'm going to age myself, 30 years ago. I am a registered dental assistant. I am also the office manager. I'm kind of the dental slave of our practice. We've been in business about 30 years. We began a co-op about 8 years ago. So that's kind of where that's run. We are the first ever in the country to do it fully, meaning that all of our services are available for direct membership.
That's awesome.
Yeah.
We're definitely going to jump into this. I want to get to why there's a need for a co-op. What problems were you having? What problems were happening in your practice and your experience with the dentists that you work with that made you decide that a co-op was something that you guys needed to do?
Okay, well, it's come to the forefront now way more than it was 8 years ago. But I mean, insurance as a whole has never been a great thing, especially in dentistry. They're very lacking in not only the coverage, but the amounts that they give the patients. We won't talk about how poorly they treat the physicians. We were lucky enough to have never been in network with any insurance, but we took them all. So
Sure.
We didn't get hit quite as hard, but we still get hit hard. You know, the basic problem would come about in a nutshell is, the doctor isn't getting paid for doing any work. The patients weren't getting the care they needed, and the insurance was making out like a bandit. We knew in 2008 when the government kind of went, we're going to take a hold of your healthcare. We kind of knew what was coming down the line, and we knew we needed to figure out a solution because this wasn't going to work a whole lot longer, and we knew everyone was going to basically suffer for it. So we kind of stole the model from the medical community. We actually saw it on a TV network show that we watch. The guys that started out in, I believe it was Kansas City. So I run the guy down like a complete psycho stalker. And I give him a call and said, hey, we absolutely love what you are doing in the medical field, and we want to do it in dentistry. And he said, how can I help? Guy was great.
Wow.
It took us about 6 months to really kind of figure out how to make it work in dentistry because it's a little different than it is in the medical field. We all do microsurgery all day long. So it's a little more in depth than seeing patients and it being just mostly your time. We have time and we also have a lot of supplies. So it took us a little bit to figure out how to get it to work in our model. And then just, over the time, we kind of went, oh, can't do that. Okay, got to fix that. All right, nope, that's not going to work. Let's fix that. Till 8 years down the road, we've got a really good, solid working model that does well for everyone, does well for the practice, does well for the patients. It's a win-win for everybody.
Yeah, that's a big elephant, right? I think a lot of people have probably thought about this, but it's a big elephant to eat, right? It's definitely one bite at a time, done over 8 years, like you mentioned before. So tell me why participating in a co-op, how does it benefit patients, right? So I think we kind of have an idea and most people are going to know, but just really quickly, how do you see the benefit in patients and what does it cost for patients?
Basically, the cost is tremendously less than dental insurance. We get improved patient loyalty. This is set up to encourage patients to get the maintenance care that they need so that we can avoid the dental emergencies in the future. That's kind of the whole part, is to get them to see this is really important, not over just for your mouth, but for your overall health. But also we want to stop those emergencies from happening. Pain's the great motivator. So we want to try to keep them out of that. Patients absolutely appreciate the complete and total transparency, in how things work. There's I hate to use the word ignorance, but there's a lot of dental ignorance when it comes to the patients. We're just not doing a great job of explaining what we do and why we do it so that the
Right.
patient can make the best decisions for themselves on how they want to proceed. But,
Sure.
the amount that the patients is having to pay, we're making it affordable for people to get the dental care they need when they need it
Right.
without us having to ask permission from anybody else. So the patients really it's the affordability for them. They know exactly what they're looking at before we do it, and the encouragement for them to do the things that they need to do and they really want to do.
Right.
This is just giving them the ability to do it.
Sure. What is it? Is it a monthly fee that the patients are paying? Is it an annual
It
fee that they're
it is.
paying?
So it's a combination. It kind of my joke is my selling pitch to them is this kind of works like dental insurance, but we aren't it is an insurance. So basically they cover either monthly or they can actually do their membership in full. It just depends on them. Most people do it per month, and then they generally have copays
Got it.
on preventive, basic, and major. But the big kicker, and this is what really sells most people, there's no deductibles, there's no annual maximums. So we don't
Wow.
bind them to a dollar figure per year and then cut them off. And there's no
Sure.
denial. If we can render the service, it's covered. If we can't, then it's not.
Right.
We
Yeah.
can't figure out how to get specialists into it. So this is mostly for generals at this point in time.
Okay. So for general dentists that want to know how they can get involved, how they can participate, how their patients can benefit from this, what does that look like? Just tell me, how does a dentist benefit in general from this? Can they continue to work with any of the insurances that they are in or out of network with? Can they continue to accept their in-house plans and continue to sell their in-house plans? Tell me, what does it look like for a dentist?
The wonderful thing about this program and the way that we've set it up is, and this is huge, the dental practices keep their total full autonomy. We have nothing to do, it's your practice. We don't have anything to do with the daily running of how you do your practice. You do you, and that's basically the way that we want it. We have a model in which we all kind of work under, but it's their practice. So they can continue to take insurance while we would really highly recommend that they not be a network with anyone. And that's like a whole nother discussion for a whole nother day of why you should be in or out. Most people should be out. It makes it a little easier to explain the difference between a direct membership and an out of network. Because if they're a network, they're kind of, the insurance company owns them and they can only do so much. The patients aren't seeing balances and they have no idea what's going on behind the curtain. That's the way the insurance wants it. So it would be preferable for them you can accept any insurance you want, just get out of network, get out of bed with them, basically, as I say,
Sure.
and continue to accept the insurance. And then the whole point is to transition people out of it, because part of the thing that costs a practice so much money is just filing insurance, refiling insurance, running them down, advocating for your patients. I mean, there are
Sure.
some practices that have an employee that is their only job is to chase the insurance and be an advocate for their patients, which is it's just insane.
Right.
And
Yeah.
it's expensive.
Right.
It's really expensive. So the big thing is this for the dental office is very predictable revenue. Like
Right.
it's very predictable because, it's on a monthly type thing. You kind of know what you're going to get before you've ever picked up a handpiece or before your hygienist has picked up a Profi cup, which is kind of a
Sure.
big deal. Reduced administration burden. Wow. Like, I mean, this cuts overhead by a lot. I
Right.
think
Right.
our office overhead is like maybe 25%.
Okay.
It's pretty
Yeah.
low.
That's great. Yeah.
Yeah.
For those that want to find out more, uniteddentalcoop.com is the website. And if you want to get more information from you, what's the best way to do that? If you're a dentist that wants to learn more, if you're a patient that wants to learn more, what's the best way to do
You
that?
can go to my website at uniteddentalcoop.com. You can email us at tammy@uniteddentalcoop.com. I am on pretty much all the socials. I am on TikTok. We are on YouTube. We do have some instructional videos a little bit on there as well. We're on
Sure.
Facebook. You can find us there. LinkedIn, we're pretty much everywhere we can humanly possibly be. You can call our actual dental office if you would like to do that. I'm happy to give that number if you want me to do that. You can call us straight from there.
Yeah.
There's every way to reach us.
Yeah. What's that number?
It is 423
Yep.
744 0668.
Yep. I'm glad that you mentioned the person that you ran down to get more information and to share with you. And obviously that person had an abundance mindset. We have an abundance mindset here. That's why we have competitors that we have come on the program, right? We think that we can all collaborate and do much better. And I'm really grateful, Tammy, for you coming on today and collaborating and sharing, giving some dentists some ideas and some things that they could possibly do and other alternatives to make their lives and their patient lives better. So thank you so much for coming on today.
You are so welcome. Thank you so much for having. We really believe in this program. We've sunk literally our entire life into this program, and we really think that this is going to be the future, for dentistry. And it's an easy thing to do because we've already figured it out, and it doesn't cost the dentist anything. That's the big thing that we
Sure.
really try to get out to people is every time we have the new latest and greatest thing in dentistry, right, that they all want.
To
They want a
change.
lot
Yep.
of money, right?
Yep.
Especially for us out here that are struggling. It's a hard thing to do. It actually doesn't require them to really pay anything, to be
Yeah.
honest. So it's a big deal. We're here to help. We want to show people how to do this. Here to help. We want to show people how to do this. Their success is important to us because it's the only way we're successful. So we are absolutely committed to showing people how to do this, help them manage it, get it out there. Social posts, like we have it all. Like we have everything already done, contracts, media, all of it. We are ready to go and show people how to, work better for yourself. And
Yeah.
more importantly, work better for your patients because we all benefit when we can do well by doing good.
Yep. That's awesome, Tammy. Thanks so much for being here today.
Thank you so much for having me. I hope to come back soon and have another conversation.